should you get a job in the NHS and the nursing care home, which one would you go for? I believe that at this point you are thinking, you are really contemplating, so should I go for the NHS job or the nursing care home job? Don't worry about it. This is a topic I'm going to talk about in this video. So if you think it will be of much interest to you, why don't you come with me as you look at that? I'm going to share with you the 6 factors you have to consider if you have to choose between an NHS job and a nursing care home job. So if you are interested, come with me. Alright, welcome back to my channel. My name is Setstakwachma. You can simply call me Kobe. If today is your first time being on my channel, I really appreciate you for being here for the first time. And if you're a returning subscriber, it's because of it that I'm always motivated to make new videos. Now, the motivation for making this video is coming from a friend who has gotten 2 job offers in the UK. One from an NHS hospital and then the other from a nursing care home. So the question is, if you are the one, which one would you choose? I want you to leave your comment in the comment box and tell me the reason why you go for an NHS hospital over a nursing care home, or you go for a care home job over an NHS hospital. Alright, so just as I'm speaking to you now, you might be in a similar situation and you are contemplating, should I go for the NHS hospital or I should go for a nursing care home? I'm going to share with you 6 factors you have to consider. The caution I want to put forth before I outline these factors is that you don't just have to rely on one factor to choose an NHS job or a nursing care home job. Put all the factors together, and then they will help you make an informed decision. I just don't know why, but among all the 6 factors I'm going to talk about, the last factor is the most important to me. Alright, so let's see the first factor you have to consider. Number 1, consider the pay rates. I don't know why you are coming in. I don't know why you are traveling to the UK to pursue your career. It may be because you are seeking for financial independence or financial stability. Okay, so for most people who are coming in here, beside the career development and other factors, they are looking out for stabilizing their finances. So you should be looking at the pay rate. So the question I want you to sit down and ask yourself is, if I join the NHS, how much would I be paid per every hour? Then how much would I be paid annually? And if I should join the nursing care home, what would be my hourly pay rate and then my annual pay rate? These are important questions you should ask yourself. Then if you are coming in based on the money factor, then you are looking at the institution that can pay you much more than you expect. Okay, so this is one factor you have to consider. Number 2, consider the type of patient as well as the environment. You see, if you are that nurse who likes taking care of certain types of patients, then this can influence your choice. Let me explain. You see, in the nursing care home, most of the patients in there are usually the old age, then those with certain specific conditions like learning disabilities, like dementia and then stuff. So the question is, do you like taking care of this type of patients? And in the NHS, we have influx of people who do come in to seek for healthcare. Some includes children, the adults, the old age, those with learning disabilities, those with special conditions. So you have to consider this as well as the environment. Okay, so the NHS is a fast-paced environment. It's always busy, unlike the nursing care home. So the question is, are you happy working in a busy environment rather than a stabilized environment? And let's say you are that type of nurse who likes to take care of children. Probably remember that in the nursing care home, it's unlikely to see children in there, which means that that environment won't be a best fit for you. But then if you are the all-round nurse who is willing to take care of every patient regardless, then you have no cause to worry. You can choose whichever one you want. I want to say that if you are looking forward to learn how to apply for UK nursing jobs the right way, I've got your back. I've done a complete course on this because I've got people ask me every now and then to teach them how to apply for UK nursing jobs the right way. Alright, so the third factor I'm going to talk about is career development. And I believe that for most people, besides the money, they are looking at the possibilities available for them to develop their career. In each of these settings, whether the nursing care home or the NHS hospital, they've got different ways of developing your career. Now, there are some of them that are common to both sides. The nursing care home as well as the NHS hospital. For example, in both settings, you can develop your career through workshop training, sponsored top-up programs, undertaking online courses, and then yearly promotion. And the question you have to ask is that, what more can the NHS offer in your career development? And then what more can the nursing care home offer in your career development? So because I work in the NHS hospital, I can speak more of that. One thing I've come to realize is that, you see, the NHS can offer you the platform to change department or work in different ward environments. And with this, the nursing care home can't offer that. And the NHS provides you more opportunities to work in specialized units. For example, you can work in ED, you can work in the respiratory ward, you can work in gastro ward. And as much as you are working in this department, you get to meet many different conditions, you get to meet patients with complex needs, and all these things build up your experience. And this is one way you can develop your career in the NHS. But then in terms of this factor, to choose between the NHS or the nursing care home, you should be able to discover the mode with which you want to grow your career. Is it by workshop training? Is it by undertaking online programs? So you have to discover that and then find which setting can offer that mode, and then you are good to go. The fourth factor I'll talk about is easy switch. You see, some nurses will say that I would like to start a nursing care home job and then later switch to the NHS. How easy it is, that's the question. Or how difficult it is. This is the question you have to ask yourself. But then what I would say is that, you see, forget about whether it is easy or difficult to switch to work in the NHS from a nursing care home or from a nursing care home to the NHS. The easy switch as used in this context is about how you can fit in the NHS or how you can fit in the nursing care home as quickly as possible and adapt to the roles you'll be given. Most people argue that nurses from care homes do struggle when they come to the NHS because, in the nursing care home, they are only limited to doing one thing over and over again. But in the NHS, you keep seeing new things, new procedures, new people every now and then. But then I think that this argument is not so relevant. What is more important is understanding that, you see, it takes time for the eyes to adapt to a new environment. You see, if you are from the NHS and you go to a nursing care home, you may struggle a bit because the environment is very different. And if you are from a nursing care home and you are coming to the NHS, you will find it a bit difficult because the environment is different. But all you have to understand that wherever you find yourself, because the environment is new, you'll be undertaking induction programs, preceptorship programs, and all these are tools to help you fit in as quickly as possible. So I don't think this is a major factor you have to dwell on. But all just look at it. It's one of the factors, okay? The fifth point I'm going to talk about is very dear to my heart. It's dear to my heart because, you see, most people are losing it. Before you choose between an NHS hospital and a nursing care home, think about your OSCE training support. This is very, very important. You see, there's this argument out there that most NHS hospitals do treat their overseas nurses very well, in the sense that they've got training test centers for OSCE preparation, and that they tend to give them more time to prepare before they book them for the test. But this is not so in the nursing care homes. I know some nursing care homes who only prepare you for 1 week to go and write your OSCE. But then most NHS hospitals will prepare you for at least 2 weeks or 3 weeks, and then make sure that you are really confident in yourself and you can be booked for the test. So this is one important factor you have to consider. I think it's worthy of asking your employer how best they can help you prepare for the OSCE, and not just focus on the other aspect, because if you don't pass your OSCE, your stay in the UK will be bitter, okay? Because it's the OSCE that will determine your stay and then perhaps your stability. So it's so important to think about this as well when choosing between a nursing care home and an NHS hospital. Which one is willing to give you the best support in terms of your OSCE preparation? And the last one I'm going to talk about, which is so important, as I said, is, I want you to guess, job security. I don't think you would want to come in here and then in about 3 months you lose your job, or some years to come you lose your pin. So the question is, between the NHS hospitals and nursing care home, which one gives much more of job security? This is a question you have to ask yourself. Now, most people think that when you get a job in the nursing care home, you are not really much secured, in the sense that most nursing care homes are not publicly funded, okay? They struggle with financial situations. At a point, they may turn up laying off some of the workers. At a point, they end up closing down. But then, you see, with the NHS hospitals, what they said is that because it's government sponsored, it's very difficult to lose your job in the NHS. And then one observation I've made is that with all the stories I've read about nurses losing their pin, nurses being suspended for that and that, most of them are coming from the nursing care homes. But remember that that is not the only factor you have to consider. You have to look at the other factors I've talked about as well. So these are the important bits and pieces you can look at when choosing between an NHS job and a nursing care home job. If you've got any question, don't hesitate to leave that in the comment box and I'll quickly give answers to that. Thank you very much for being with me up to this point. Hope to see you in my next video. Bye.